Hi guys, happy last SLO number 6. Really excited. I hope everyone had a really good practicum. For my video, I'm going to focus on the effect of nursing and other interdisciplinary team members that have upon care processes and outcomes for patients and families within the healthcare setting. So I've talked about this before, but I was doing my practicum at the infectious disease clinic at UVA. And as I've said before, one of the really big focuses for our clinic is on HIV patients and hepatitis C patients. And I don't want to say this to stereotype people that have contracted these infectious diseases or to say anything bad about them or their character. But from what I've observed in the clinic and from my own personal research, a lot of people that have been infected with HIV or hepatitis are on the lower income side, and I'll elaborate on why that is in the social determinants of health that have led to that to begin with. So for them, a big part of servicing these patients is reaching their social needs that need to be met. And again, our clinic, we have to consult with pharmacy as well because they have a very specific medication regimen to be on, and their viral load has to constantly manage so that it can be as low as possible, especially if that person is already very high risk or has just been infected. But I'm going to focus mainly on how our clinic has to interface with social work and the caseworkers that help our patients. So I'm just going to dive into some of the social determinants of health that affect HIV patients specifically. So one thing I've noticed in clinic, and you would expect this from HIV patients, is that a lot of them are gay males. And as we know in society, people who are homosexual or in homosexual relationships often face a lot of stigma, especially depending on the type of family that they're from. And it's even worse here because we have a little bit more religious area and very rural and conservative in most parts, and then we don't have these city sanctuaries or shelters that people can go to. So what often happens is a lot of these guys will sometimes be living apart from their family and completely separated from them, obviously because of their sexuality and how that's ostracized them. And so that leads them to be homeless, or sometimes they'll live with these, their boyfriends. And that's fine, but one of the reasons I'm bringing this up is because a lot of these relationships aren't very healthy, especially really younger guys. I keep getting people that come into the infectious disease clinic that were partnered with men that were much, much older than them. And I think when they're talking about certain things and they're looking back, they're realizing how they were taken advantage of or misled in a lot of ways. So it's very common for HIV patients to have a consistent lack of social network before they're diagnosed with HIV, just because a lot of them happen to be homosexual or bisexual or transgender. And then another thing that this leads to is people joining certain subcultures and subgroups that use drugs, and using intravenous drugs is another way to gain HIV. So I kept getting these patients that were obviously very, very low socioeconomic status or unhoused, and this made helping them even more difficult, especially with transportation. So sometimes when people come in for their first time at the HIV clinic, sometimes it's because they've been diagnosed, but they're moving to the area so they need a new provider, or they just recently became diagnosed. So we try to set them up with social work. We also have this survey questionnaire where we ask them the social determinants of health, which kind of dives into what their economic status is looking like, what their partner status is looking like, and how that's affecting them, and if they're depressed or not. And then based on that, how they answer those questions, we'll bring in a case manager or a social worker if they feel like they really need the help. So what I've seen a lot of people that work in case management and social work do for these patients in collaboration with the nurses is they will set them up with certain food banks to try to get them resources. And then we know a lot of my patients actually took the jaunt to get in, and as you all know, that's I'm not sure if it's free or if it's low cost, but it's a transportation service that can bring people in so they can get their health care. So that's one way we manage the social aspect of their life and the economic issues that they're facing. Another way that we help them both economically and medically is that a lot of these people qualify for the Ryan White HIV or AIDS program, and this helps lower the cost or possibly get them free antiretroviral treatment and medical services if they have like a documented HIV diagnosis and they happen to be low income and the residency in that area can support that program. And fortunately, UVA does as of right now. So that's kind of how the nurses can come into play, because it requires them to keep up notes on these patients, and the providers also have to give them the official diagnosis. And another way that we have interdisciplinary teams that come and help us at the ID clinic is we actually have our own psychiatrist, which is Dr. Marzani. And she is a psychiatrist that focuses specifically on HIV patients. And when I was talking with Dr. Marzani, one thing she mentioned to me was that a lot of her patients, of course they have HIV, but she was explaining that some of the things that led to them possibly even getting HIV are their actual mental health in general. And that really changed my mindset, because I approached her asking her about her care and her work with these patients, thinking that she just really wanted to help people with HIV, which is true, she does, but she also has an interest in mental health as it relates to the choices that people make later on in life. And one thing she brought up was a lot of these people actually have a bipolar diagnosis or they have major depression. And because of their mental health diagnosis, sometimes they find themselves in really poor situations or very socially isolated. And that can lead to them getting into more like high-risk situations, including unprotected sex or use of drugs. And eventually they become HIV positive, and then of course they'll have to continue with the treatment and manage that for the rest of their life. So for my personal thoughts and my own reflection on this clinic, I definitely took that experience to heart, especially what Dr. Marzani was saying, because I had certain perceptions about this diagnosis and why people get this just from like media and my own research. And so I saw a really different perspective when she brought that up about like what could lead to someone even getting into these high risk situations. And I like that I've been able to connect with patients and meet with patients, because they're not all the same. They definitely have their own different struggles, but they share certain things, like when I mentioned that a lot of them have had really poor partners and been abused in that way, and then many are socially isolated. So that's something that I'm becoming more aware of when I'm speaking to patients, especially something I'll take into my practice when I start actually working as a nurse. Just the different backgrounds that people might have, and to really understand like how they're seeing things and what they're experiencing. And I think that'll help me best figure out how to actually help them. And my preceptor is of a similar mindset, because she kind of fell into working in the infectious disease clinic. Before that, she was working in cardiac, but she's really grateful for the experience because it's really opened her up to like community health in that way. And she's obviously a big supporter of the Ryan White program, because it's helped so many of her patients. And as we know, under this current administration, like we're losing a lot of funding in some things because it's not popular under this administration. So I feel like it's really shown her like how to be an advocate for patients, also in the hospital, but also politically. Like that's something to think about when you're voting for things both locally and nationally, how that's going to affect funding and how that could affect healthcare in the United States as a whole. And I'm just going to tie this up by saying this all relates to nursing practice, because I feel like in the infectious disease clinic, people have had to be very creative with how they can help patients socially, financially, medically, and help them like plan for a future. So I think being able to speak to everyone on the team, including the pharmacists, the psychiatrists, also the social workers, has helped me gain like so much perspective on like how much it takes to actually get a positive outcome for a patient, and all the factors that could go wrong or everything that we could do correctly. So I'm really grateful for this experience, because there's just a lot more to patient care than just like giving people medications. So that's pretty much all I have to say, and I really hope you all enjoyed this video. Bye.